Firstly, I would like to welcome everyone. Thank you for taking the time to joining this amazing webinar, where we're going to talk about the transformation in the healthcare segment, which has been propelled by digitization. As you know, technology has significantly altered the healthcare landscape in recent times. Hospitals, diagnostic service providers, insurance companies, pharma companies, almost every player in the healthcare domain has rapidly adopted digital transformation initiatives. During the ongoing pandemic, many healthcare players have leveraged telehealth and remote monitoring to minimize hospital visits without compromising on the quality of care that they extend to the patients. Now, they are looking at ways to balance these digitization initiatives so that it keeps patient health and customer experience in the forefront without impacting their IT budgets. In this webinar, we have stalwarts from the healthcare industry who will discuss about the opportunities that digitization offers to hospitals and the ways they can use it to reshape how customer care is delivered. At the same time, they'll also touch upon how digitization can address performance challenges while lowering overall costs and help them build new revenue streams. I would like to welcome our esteemed panelists and introduce them. We have with us Mr. Chakraborty, the COO of Hinduja Hospital, and we have Mr. Prashant Singh, Director and CIO of Max Healthcare. Also joining us are Mr. Neeraj Lal, Cluster Head and Vice President of Rainbow Children's Hospitals, and Mr. Rajiv Sikka, Head of IT at Medanta, the Medicity Hospital. The other panelists who will be joining us are Dr. Nilesh Shah, President and Chief of Science and Innovation for Metropolis Healthcare, Dr. Mudit Saxena, MD and CEO of Ovum Hospitals, and Nikunj Thakkar, Enterprise Solutions Consultant for Managed Services at HV. The entire session will be moderated by Mr. Vibhor Srivastav, the Group Publishing Director of ITP Media India. Now, I would, before we begin the panel discussion, I invite Mr. Nikunj Thakkar to share some insight about the potential of digitization in healthcare and some challenges it can throw up. So over to you, Nikunj.
Thank you very much, Vinita. I really appreciate this opportunity being organized by ITP, and we are actually going to make sure that in this productive webinar, we should be able to pose some of the real challenges and the solutions around to help on the clinical and non-clinical functions in the healthcare. And we'd like to have our panelist experts to give us their inputs, and then we can have a session forward. What I'd like to start with is that how we can build a great foundation for a true health IT with a connected healthcare solutions. Okay. What I actually like to quote here is that Dr. Muthu Krishnan, who is a renowned CDTO at IKS, the saying so that organizations have to have an ideal partner to facilitate 3 stages of digital transformation. And that is converting the data from physical to digital, converting digital data to make processes digital, and then leveraging that information to transform how the business decisions are being made. When I have to talk about that how we can able to make this happen, I need to bring to the table that how the connected healthcare solutions of tomorrow's are going to help us to achieve that, wherein we can see that the platforms required for the enterprise systems to handle the unstructured content as such, which can actually vary from the imaging files, the reports, the paper files. It can be the specialty image systems which has to be integrated. We have physical storage media with a lot of data, patient data in that. And we have got third-party cloud archives with the hospital isolated stations to be integrated. So what we see is that we wanted to do this connected healthcare for a better informed medical decisions. And when we wanted to bring to the table, the first important thing which comes to the mind is that how the healthcare systems can have interoperability. And that's where today's industry focuses that how much we are able to do that with the help of the standards which are there in the interoperability specifications as such, like DICOM, HL7, FHIR, and those integrating these enterprises with exchange of information. So what is the challenges in that is all about the perceived threat of intellectual property, and then the challenge which we have to also achieve is that the customer retention. That's where what we see today, okay, to make it happen, where are the challenges? It's all about the unstructured content in the separate repositories, whether it can be a departmental document management with a kind of packs or a risk system, which normally leverage the DICOM studies, and then also having the silos which actually store many times both DICOM and non-DICOM images put together, and whether it can be dermatology, pathology, or so on and so forth. And what we see is that it's all about many times the non-imaging files are also stored in the DICOM format, and which actually have a bigger EHR access to later. What we see typically is that how actually we need to have a centralized, okay, system which has got enterprise imaging capacities to encompass, okay, all these information which are locked and blocked in the proprietary systems today. And then we need to leverage advanced technology today like VNA, vendor neutral archives, enterprise viewing and imaging to share and exchange the information. So clinicians, okay, are right now empowered, which should be empowered with real-time image access and do the collaborative taking the right decisions. When we are referring to these exchanges, the standards which are along with the HL7 is XDS, which we wanted to establish with our capacity as an enterprise healthcare solution, so that we should be able to think about that how the patient information is accessible to them with all the stages of its journey, and we should be also able to figure out that whether it is actually clinical reports coming from the MRI, CT scans, or the X-rays of that to put together in one go, and to have all the prescriptions and the diagnosis report to refer at the same time, whether it is a patient who requires during his care journey or the medical officer requires during its actually cure journey. We are visualizing a solution which can be having a capacity to be modular, to connect to all clinical departments and non-clinical departments, okay, and should have a connectivity. Whether we will be able to manage the whole, or we should be able to, as an HP, connect the dots between the various modules which you already have to make this information exchange possible and to achieve our future of enterprise healthcare, wherein we should be able to connect to the clinical integrations required with maybe with our healthcare information system, which you might be already having, EMR systems you might be having, and in a process we give a better patient access. And of course we cannot we have to also see, when we see that there are a lot of administrative workflows which can be medical automation, okay, it can be towards the various accounts, payables, receivables, and all. They're all automation until it's not done. You will see latency in any of the engagement with our patient journey. So what we are envisaging here is that how we should be able to have an integration with your existing medical systems, and we should be able to have a single viewer of all the records, whether it would be having healthcare records or medical reports or the patient accounts, to make sure that we are all having a single view and get the information exchange easily being achieved in the enterprise healthcare solution. So let me share with you the screen, which is all about an all scripts EHR system, wherein you can see that patient records has been visualized, and there is a list of that. Once you click one of the record, let's say for John Adams, you should be able to see that all the documents related to that. Now, when we integrate all scripts with our enterprise systems, you are able to immediately view, okay, all the relevant reports without going to any other DMS systems. It's said so well integrated, okay. We can actually provide a patient window from the same system, wherein the CT scan, maybe the views, the X-ray views, the prescriptions, the ER charts, all of them, okay, the documents at one go for the patient to access. Whether of course, it's supported with the cloud, so the patients can give access with the hospital's administrative access rights. So they're able to access it so that we can have a better patient experience, and they should get the information all in one go. This is equally available to the medical officers when they want to take the medical decisions, as we are referring right now the screen for the patient window. So if somebody wants to really pull out the relevant report immediately, this systems gives you access into the documents there and there, okay? And we can call out the videos, okay, which we would have been received from the medical systems. And it is perfectly integrated with our vendor neutral archive capabilities so that it becomes seamless between your EMR, HIMS systems and the access. What HP also has done is that they have got the first industry integration with the radiology devices to review in color the print reports and the films, which can reduce the data loss. We also came out with the devices which is actually much more having capacity to sterilization, so that the new post-COVID age, we want the daily sterilization of the devices to reduce the infection capacities. We came up with the silicon drapes for the devices when you want to access these all information via the devices to print or to scan to. This all with the compliance of ENIC, so with the 606X edition compliance for the minimizing the infection when we're accessing the devices. So the healthcare customer, the patient's journey, okay, we should be also making sure that we can automate the wellness reminders, okay, the appointment information, the billing notifications, the prescription messaging, and also the laboratory messaging and the pre-procedures before any kind of surgery or an appointment. This all leads to a very high customer satisfaction with a kind of professional approach and easy access to the information available. Administrative workflows, we can put in all the automation to the intelligent process automation to make sure it can read all the invoices, all the receivables information, and give it access to the payment processing so that we can eliminate latencies in the Mediclaim clearance and all that. The contracts is so important management because we have got various vendors with the devices, owners, OEMs that can be managed. And we can, of course, we have got most important is the policy management and procedure management across the great hospitals to follow. Security is so eminent, and we are very much actually have brought the technologies for the prescriptions to also be secured so that nobody is actually creating the copy of that and playing when it comes to various industry uses of the prescription. Okay, we mitigate that with the hard copy security solution. With the increasing cyber attacks, the PHI, the personal healthcare information, becomes so critical to protect. Specifically when it comes to the medical tourism, we need to make sure we protect to have our India brand up for the medical tourism destination. So we have come up with the first industry endpoint security for our devices to make sure that no breach is happening entering from our devices at all. Similarly, for the data being traveling to scan and print, we are protecting that equally with authentication and authorization. So with that, what I wanted to conclude is that we have to improve the visibility of the patient information. We have to improve the clinical workflows with integrating with the interoperability standards. We have to make the search capacity just like the Google search by anybody who wants to access the information is authorized to with the proper filters and access controls. We want to get the cost savings through, whether it's going to be the tech refresh required because of the non-standard of information exchange, or which is going to be for a lot of administrative workflows, which still actually has got a lot of silos and manual intervention. We want to automate that to reduce the cost. We have to focus on integrating the clinical systems, as I said, and the all important part is security and to have a trusted technology partner to enable these solutions to work put together. Thank you, and with that, I'll hand over back to Bibhor so that we can take this session to be on more productive note.
Thank you, Nikunj. It was really informative to learn so much about the kind of solutions available. I now pass on the baton to Mr. Bibor Srivastav to begin with the session. And let's get started. Over to you, Bibor.
Wonderful. Wow. What do I say? Thank you and very warm welcome to people, ladies and gentlemen, for joining us. Really set the tone, set the mood. I really love your few slides. Became, for example, connected healthcare interoperability, connected healthcare enterprise healthcare solutions, capabilities. I think HP is right at the forefront, providing its straddle across the entire spectrum and the journey of healthcare. So, ladies and gentlemen, I think you will be more keen to hear what the panel is going to say. And let me invite my very dear friend, straight Dr. Mudit Saxena. May I request you to unmute your mic, please? And getting straight to him, who I have known for many, many years now. Doctor, just a question. How can digitization of patient management systems lower operational costs for hospitals? Can you please give some examples on how it has helped your hospital in this shift away from physical management of patient charts and records to a digital one? So I think what we really want to understand is how are you enhancing the patient experience through digitization? Dr. Mudit.
So, thanks, Vibhor, and thanks for this wonderful talk, Nikunj. I think there are a couple of questions which are being thrown at Nikunj, and I think that will be the right place for him to take those up. But the typical thing which we've been observing in terms of the digitization bit of patient management and the cost lowering bit, mainly as I think Nikunj has pointed out in his presentation, is mainly on the operational cost bit, where you see how it has been, it's been working through the silos and stuff. From the net global spending, if you look at in 2018, they were about roughly about $1 trillion, which was spent on digital transformation across the places. And it is expected to go to about 2 trillion. So I'm sure Nikunj is in the right place as far as expansion and digital transformation is concerned. But I think the point which he made was very important and very interesting was that during the COVID time, if I see in past 6, 7 months, most of the healthcare units as well as industries, I'm talking about general industry apart from healthcare, 79% of the companies have increased their budget on digital transformation. It was not there earlier, but now they've started doing it. And a study which was done by MIT that reflected that, almost there's a huge profitability associated with this. In terms of the hospital work, where we look at, we have patient orders for like lab, pharmacy. When it goes through these barriers, automatically you reduce a lot of time which is wasted in terms of from manpower workers perspective, where people are writing, then waiting for an attendant to carry these orders. You save on paper, or paperwork, then management. And I think what has also happened is during this COVID times, when we have seen that the digital transformation, where the interaction has now turned more on digital platform, where you are seeing that patients are walking in and rather than walking into the hospital, they're coming online and talking to you. And that point of time, their trips to hospital has come down, which reduces the workflow in the OP. That is your outpatient area. You have decluttered your OP, less number of people, less number of cleaning, and of course, less number of manpower to monitor all this. So I think overall, this bit, if you look at it in terms of the tangible benefit which comes with it, definitely it has done a lot amount of work. Apart from that, the typical work is medical record decrease and growth charts. You don't have paperwork, so you decrease on all of that. And then even patient billing and insurance portals, which get actually seamlessly integrated with it, that also again saves you a lot of time. And I think that time needs to be tangibilized in terms of when you're talking about cost, because that's very important. And apart from that, there are patient services which has happened. And I think that's what we have done. Most of us have done in our hospitals. I think Joy would be mentioning it. Even Neeraj would mention it, and then Medanta also. We are also in a typical sort way where we are doing medical records, EMRs and stuff, where we are doing electronic medical record and data, which gets stored. In terms of how it has been enhancing the healthcare service providers, I think the mobile devices have become the key right now for the customer, because that's his tool and that's also the device with which a hospital interacts with it. And it is no longer the customer, but his journey with you, which is the key for every hospital. So you don't look at the customer, but you look at his journey. And the more number of times you engage with the patient, the more likely are that you either get referred or he would try your product or he may try your service. and he might like to avail it. And similarly, he might refer you to more people. And I think all of us have been doing this by creating a lot of our our visibility on uh, WhatsApp posts, blogs, through email. We get our brand approved, we get our services awareness about our services. We have testimonials from patients who have tasted our services, who have gone about talking about us. There are Google reviews, which actually help us to talk about our high points, also to talk about areas of challenge which we need to work upon and respond to. I think the other bit which has been very, very important is that you take customer as your partner, your patient as a partner, and you involved him in getting educated on this. So like during Corona times, we created small, hand wash techniques, which we went on our Facebook pages. We also put it on our website. And then we also did through a WhatsApp channel, we circulated among all our teams, as well as for our clients, that this is the right way to hand wash. This is what you have to follow the protocol if you're coming to the hospital. So it becomes that they are no longer taken as a visitor. They are taken as your partner who gets involved in your day to day. And many of the patients, in fact, were sweet enough to actually respond and say, can we use this? And it creates a kind of a good platform to engage with them. As I said, we have also created events where you are talking about patient or clients based responses. And based on this, when you look what patient likes, and I think a lot of AI is being built on these tools now. So based on their clicks, the choices and their preferences, you start predicting their behavior, based on which you can then start predicting in terms of what will your client like or what will be your customer like. And since I'm in birthing, we would start looking at what are their expectations. We have also looked at for the neonates, what are they worried about? The mothers are worried about being, how will they go through the delivery journey? How will they interact? So we create that ecosystem around them. When they come to the hospital to deliver, we know what they want, and that becomes very, very good. And as far as engagement as I'm concerned, we do a lot of activities like nutritious diet. So you'll do like Khana Khazana. So similarly, you can do a kind of a small program for them where all these young mothers to be come along, and then they undertake and make food and stuff. So I think that's the kind of a bit where you start looking at, not only look at a cost, you look at engagement, which will then translate into a revenue upside.
Thank you, Dr. Mudit. I think absolutely. I always used to feel that we look after our customers and more partners, but I think there is something amazing that is happening is in healthcare, that you truly map the journey of the customer and make them truly the partners. Treat them like one. And just let me take a very quick opinion from Dr. Joy. In terms of how in his hospital, I mean, especially in the group. Uh, Dr. Joy, what are you doing to enhance the patient experience? And before Dr. Jai, get on, may I request the audience to please write their questions in the Q&A, please. Please post your question in the Q&A. Thank you. Yes, Dr. Joy.
Thank you, Beaver. Thanks for this question. And I want to really compliment Nikunj for the wonderful presentation and sharing with all of us the kind of work they are doing and providing as a solution to hospital like ours. So to begin with the question that what we are doing, I think some of the points what Mudit has already mentioned, those we have, but what we have done close to 6 years back from now, we did the entire mapping of the customer journey. So it starts with the pre-hospital arrival or starts with the appointments what they book for themselves. So from there till discharge and post-discharge intervention. So the entire process has been identified. So it starts like that patient who were, looking for a thing through website and other means, they can take appointment. But the crux of the thing is soon after that, they are prompted with the digital payment system. So today, during Corona and this scenario, it is a very common phenomena. But let me tell you, even much before our Prime Minister thought about, demonetization, when everybody was under the several stress, that how do you manage on those days without having cash? In our hospital, we introduced all sorts of digital payment system and mechanism. Subsequently, if the patient has taken appointment and going to visit the hospital just before the previous day of their appointment, they get the system generated automated call. And that call goes to them, and that during that call, we confirm whether they are really going to visit or they have a plan change in their plan. If they have a change in the plan, then again, through system rescheduling their appointment. So we can't afford to miss some of our patient and lose business. So keeping that in mind, those who are not going to come, rescheduling, and those who are coming, confirming them. Once when they are confirmed, their payment is done online. Automatically, I heard about the digital records and medical records. Those things are up in the doctor's system, and they can access the entire patient medical records from there. Once when the this thing is done, consultation is done. Earlier what was happening, that documenting things in a piece of paper and going. So right now we are still doing that, but we have converted and we have introduced a system when this paper written documents, whatever doctors are generating, that gets automatically digitized and that gets stored in the soft form. So for future it is readily available. If a doctor is giving any prescription, any diagnostics services request, so the format is such, all the requests for these tests and other things are generated and it goes to the concerned department. So it shows in their wait list that these are the people have been advised for X-ray, CT scan, MRI, and even if it is pharmacy, that pharmacy medicine request is queued up in the pharmacy. So once they finish, subsequently the thing link goes to the patient for fixing the next appointment if it all required and advised by the doctor. And subsequently, if anything is done, if anything is required, investigation which needs to be done later, fixing of appointment is done through system. Plus, we provide the home care, so where patient need not to travel all the way to hospital once again, the scheduling. So that scheduling is also done in an automated way. So this is about the outpatient. Now for the inpatient, we have almost similar things starting from the bed booking, reservation, admission, and some of the things what we have added there, what I have not mentioned, on regular basis giving them their itemized bill, so they can't afford to say later on that I have not been told about this particular amount, I am not aware about it. They can get to see all this. Some of the things what Mudit was talking about, releasing reports available, and they can sit at home and get it through our PACS or laboratory information system. And all those, when it is available, not only it is available with the patient, but it is also available in their file, which is getting automatically uploaded. Post discharge, again, the home care services is tagged with the patient, and then they can avail. Subsequently, after discharge, if we know somebody is a chronic patient, has some chronic disease history, we connect them with that particular disease management program where they get regular update in terms of what are the like if somebody is hypertensive, what are the do's and don'ts. If we have a education program invitation to them, if we have any material for that. So similarly for different diseases, we have this disease management program attached to the that particular patient who has been diagnosed. So this is like a whole cycle what we have for the outpatient and inpatient. So this is the way we try to give a better patient experience when they are visiting us.
Wonderful, wonderful. I think that's a tremendous work that's going in the Hinduja group. And I think let's also look at, we heard it from your end, from Dr. Mudit and Joy. But let me get it straight into, people who are really at the helm of affairs, who are providing this technology. And we, ladies and gentlemen, we are joined by two very exceptional people in the group here, Rajiv and Prashant. And let me come to Prashant here. How you're making technology and life easy and customer centric, patient centric, happiness and everything, all the things that you're filling in. Let me ask Prashant, how would you define digital interoperability in healthcare? What are some primary concerns that hospitals have when it comes to interoperability of existing health information system? Because Prashant, this is a very key thing, and the cap that you wear is a very, very important one.
Yeah,
Yes,
yeah.
Prashant.
Thanks, Vibhor, for asking this question. Taking the thread from Nikunj, basically, when we were talking about the connected healthcare. So, if we talk about connected healthcare, then interoperability, plays a very, very important role. because the healthcare ecosystem is a very very complex and hybrid kind of environment. Actually, there are, where multiple devices, along with the applications and different information system, everybody is trying to talk to each other, through various protocols and technical platforms. So if we were to go to the definition of interoperability, without getting into very very technical details, basically in a very very simple common language, basically. So this is the ability for any healthcare information system actually to exchange between medical devices, other information medical applications, and other information platforms, basically, so to say, so that each and every information can talk to each other in a cohesive manner. Basically, there are various parts of data exchange where there are one way or two way communication and things like that. So this is goes about the definition of interoperability on a very very higher scale, basically. So if we take some examples, basically, so just to give you a very very low level example, like for example HIS talks to LIS or RIS. So there are a lot of information exchanges which happens between these platform, including medical equipments, actually, which throws a lot of patient information to various softwares like LIS and HIS and RIS for that particular matter. There are a lot of parameters, actually, which play important role. For example, if you talk about protocol like DICOM images, so this protocol is being used when a lot of images are getting transferred between the medical device and the software, things like that. So further, since ever since, actually, we have talked about the NTHM. Actually, we have heard about NTHM, National Digital Health Mission. So now the realization of interoperability word has really increased. Actually, now a common man is also understanding the value proposition of the interoperability. So in just to give you a small, very very small example, actually, on the protocol side. So there's a protocol called FHIR, basically FHIR. The full form stands for fast healthcare and interoperability resource. So which takes care of the communication between several ecosystem across the boundary of the healthcare also, basically. This is what NDHM is talking about. Of course, if we come to the importance of the interoperability, and then it creates the cohesive visibility of the healthcare information system, which not only enhances the patient safety but also helps in better patient care. So and there are different types of interoperability, actually, not getting into very very detail, basically, maybe high level categorization which we can do on the interoperability side, like foundational, wherein the receiving system does not really need to interpret the received data from the source data. So likewise, actually, there's another category called structure, another category called semantic, where there are a lot of interpretation happens between two different systems, which is involved in the data transfer and all. But having said all of this, basically, there are still a lot of concerns, actually, as far as the interoperability between different ecosystem out of the boundary of the healthcare is concerned, basically. So which is there, although there are a lot of standards, actually, which are available, which helps enhances the interoperability measure, but the adoptability of the standards is really a concern, wherein actually, unless until you are actually and two different ecosystem are on the same standard, actually interoperability is still an elusive thing, basically. So that is the next step, actually, in terms of interoperability. And I think when with NDHM coming to the picture, basically a lot of new energy which will come into the system, actually, in terms of adopting a lot of standards on the EHR, so that a lot of interactions between two different systems can really happen.
No,
So that
thank you,
is
Prashant. Yeah.
yeah.
No, absolutely. I think interoperability is obviously the key word. And I've been looking in, we run a publication in manufacturing. There's a lot of IT adoption and a lot of, IoT and, machine cognition. It's great to hear the panel talking what they are doing in healthcare. Raji, very enamored to see what's behind you. Before I pose a question, too lovely looking stuff that you have. But that's all right. Whether you want to share with the audience, that's fine or not. But Rajiv, because just laboring on where Prashant left, just a question to you, Rajiv. Why is improving healthcare interoperability such a challenge for hospitals? Is it lack of awareness, lack of standards, or complexity of processes? Of course, HP, I'll come, Nikunj is there and he talked about interoperability, but I'm going to come back very quickly on that. But Rajiv, your take on that, and then I have to come back to Dr. Nilesh and Neeraj. Yeah. Dr. Rajiv, yes.
Sure. First of all, I think that awareness is not a challenge anymore, especially when Prashant was also talking about NDHM, and most of us are aware that interoperability is feasible, possible. As everybody talked about, there are multiple standards which all of us are aware, be it SNOMED, ICD, DRL, DICOM, these are there. Then when you talk about health data exchange, fire, the something which Prashant talked about, Nikunj talked about, HL7 is there for ages now, CDA is there for ages now. All of these are very, very well respected industry standards. Lot of solutions are already there. So I don't foresee that awareness is a challenge or lack of standard is a challenge. Now, question is then what is the challenge? I think the biggest challenge, according to me, is the investment part. So, I call it as the whatever you talked about. I think that it is more of a technical barrier. So, and what we need, especially most of the healthcare industry guys, especially hospitals and other service provider, is that they need to do planned investments in their EMR stroke HIS. See, what's going to happen is that because of this, eventually the quality of care will improve. You will have improved or enhanced patient outcomes. You will have there will be definite reduced medication errors, and you will avoid unnecessary tests which are there when you move between hospital to one lab to other hospital to third. So, and eventually all of these investment will help to manage the TCO at a later stage not in short term, but definitely in mid term to long term. And other stuff which we have to do is that, see, interoperability is the foundation for connected healthcare. This is like, there is no discussion on this. Now, when we talk about healthcare for masses, what it means is that we are talking about healthcare industrialization. For this, we definitely need this interoperability. So what regulatory bodies like NDHM has to carry out is that they have to incentivize hospitals, healthcare providers. And this is nothing new. Worldwide governments have done this multiple times. There are enough models which are there. South Korea has done it, America has done it, UK attempted it, it was not so successful. But what government has to do is that government has to convert their current avatar of a service provider to a financer. That's what I think we will be able to move away from that investment barrier to a financial barrier. So these are, according to me, is one issue. And the other issue which Prashant talked about is with respect to interoperability, especially when you talk about, he talked about LIS, RIS, DICOM. So those are within the enterprise. When you talk about outside the enterprise, I think the biggest challenge which country is facing, and NDHM also to some extent, is the ownership. In digital world, ownership is very important. Now, some pertinent questions which all of us have to answer collectively is that who owns this, patient record, whether it's owned by patient or by state, because it's state subject, or by central government, or it's a collective, ownership, nobody knows it. Then how much information we have to share or how much it can be transferred. So all of that stuff, has to be kept in mind. And most important is that it is not going to be misused by anybody, including government, insurance companies, for defining the commercial with respect to a policy. So what I'm saying is that, the third part, after technical barrier, financial barrier, is the trust barrier. Now, if you say that patient is the ultimate owner, which everybody knows about it, but in a India context, how you are going to educate patient, and we know that patient, in other words, which is a customer, is a customer. मतलब वो तो मरेगा ही कस से, ठीक है? So whether we are in a position to, educate him, so I think there is a strong need for us to communicate. So there is a communication barrier also. So all of us, including government, have to come out with a mechanism by which the sensitivity of this patient record has to be informed. See, in a country like India, some of the diseases have a lot of sensitivity. There are social stigma attached. Simple example is a breast cancer. We all understand that this is a curable disease if detected in time. But just imagine, if a young girl is having a breast cancer, what kind of stigma is attached? Are we willing to share that information in a platform? Is somebody going to give 100% guarantee that this information is not going to get leaked? So there are communication barrier, and there are trust barrier, there are financial barriers, and there are technical barriers. Awareness, according to me, is not a barrier.
What, Rajiv, what do I say? I mean, you summed it up so very well. I mean, I just thought there would be a few barriers, but you said technical barrier, investment barrier, financial barrier, trust barrier, very important, communication barrier. I think more importantly, what you really touch the chord. Not many people have the heart to do it. And I think there, as an industry, there's a lot of ownership of keeping this data secured, safe, because the last example was something really, really, very important. And I'm very excited to come to Dr. Nilesha, but I'm just going to, and Neeraj, just bear with me for a second. Nikunj, can you unmute your mic? This is a very sensitive subject. We just left with Rajiv. And it's important for the awareness. At what stage, HP is going to help and, plug hole, the holes that are there, you can plug in. Nikunj.
Yeah, thank you, Bibor. And it was really delighted to see that you are immediately after the Dr. Rajiv Sikka's remarks, you brought me in, because I was just thinking when I was resonating to what he said correctly, that the improved patient outcomes, okay, that was one of the keyword which which caught my attention, because that should be the Mercury index to measure our healthcare institutions' brand value. In the whole world of when we are into the middle of the cloud and mobility, if healthcare leaves behind, then it is all of us to take the charge. Whether it is formats, standards, processes, regulations, protocols, etc., it has to be built on an intelligent enterprise to automate an exchange of information flow. That actually strikes me an example of, let's say, I had actually finding many of the instances where patient was at times made to wait because the medical claim process clearance was not there. So, I mean, that is highly unhuman, and it is so critical for us to understand that as a medical services provider organization, if we are not going to empathize with our patients, who will? So we need to figure out, okay, where is that? Whether it was process automation at the administrative function needs to be automated, or which their dependencies on our various departments to get their reports in time to clear that is something has to be in place before that. Before that, even let's say the various nursing departments or the diagnostics departments, are they able to provide the right discharge kit in time? So all these are connected when I have to measure the improved patient outcomes index. And I would like to just sum up saying so that HP is there. Okay, whether it has to be overhaul of the total foundational IT to work on clinical, non-clinical workflows, or it is a modular approach. We are there to make sure to be part of the journey with you on improving the patient outcomes. Vibhor, back to you.
Thank you, Nikunj. Absolutely. And I thought it's very important to get you in. And let me, ladies and gentlemen, I'm very eager to hear what Dr. Nilesha, I mean, some incredible experience the gentleman brings. Dr. Nilesha, please unmute yourself. These are basic hygiene. It's always good to tell. Sometimes you get engrossed in the conversation, you forget to mute. Right. And because I've been doing it for so many times, I've got used to it. I mean, even in my sleep, I can do it. All right, that's on the lighter side. Dr. Nilesh, diagnostics play a vital role in patient care. Having spent three and a half decades in this industry, please share the impact of digitalization seen by you and the future aspirations. What kind of transformation is digitalization expected to bring up? Please share some examples for our audience to better understand and relate, because I see some incredible work that you all are doing, Dr. Naresh, and I love those 3 lines that you have in your signature. Please, for my sake, tell those 3 lines at the end of your conversation,
Okay.
Dr. Nilesha.
All right. So I must say that I'm going to speak more on the diagnostic and specifically lab side. And I must indicate to the audience
Sir,
that,
can you be a little loud, please? Yeah.
okay,
Yeah.
I must say that I'm going to speak more on the lab side.
Yes.
And I must say that for your information, lab is highly dependent, not on manpower alone, not on equipments alone, but lots on IT. And IT projects, I've spent 35 years and it's not ended. It could be my inefficiency somewhere, but I gradually have started feeling the scale, the possibility, and the scope is too high to meet, and this project will never end. Going ahead, I must compare that what we used to spend on IT in olden days was 10% of the total budget. And on capex, I'm saying, and now gradually it increased to 2030.
So
But this,
just give me those data one more time. I lost you there.
yeah,
Just yeah.
I'm saying my IT budget now
Huh.
is 70% compared to my automation, means my medical budget compared to IT budget is that 70-30 ratio. That much change it has been. And I think going ahead, the pie is going to go bigger and bigger because there are too many things one can do to improve safety, quality, service, support, faith, trust, all the things put together. And to narrate with few example, I must divide the whole thing into pre-analytical, analytical, and post-analytical. Some of the areas which my colleagues have already discussed, I'm not going to go in detail, but few of the things which are very specific to labs, I'm just going to go a little bit in detail with examples. So if I say pre-analytical, one of the biggest challenge reference labs like us face, that doctor or patient do not know what test to order for a particular disorder. So suppose patient has a sarcoidosis, doctor at times would call up anything new has come to test on sarcoidosis, even in tuberculosis. So many new tools keep coming and doctor has to call up a patient as I'm suspecting this kind of tuberculosis, what is the right tool for it? Now, imagine they have access to this information on touch of the button, where by disease or by methodology or by sensitivity or by specificity, what is available for what particular disease and disorder, how reliable they are, what sample is required, all this information and make them available, it makes their life very easy. They will select lesser number of tests and less exploration they will do. Otherwise, they will keep ordering multiple tests and many a times the test could be wrong with their order. So this helps at doctor level right selection and very ease of understanding the test. From there, after the test is selected, he can order online. Just imagine there is an online ordering of the test so that there is no duplication, there is no confusion between lab and doctor also. Makes big difference. And I think these are a few things some of the people have adopted. So whatever I'm going to talk today, some of the things have been already adopted, some are on the way near future, and some is an aspiration, nearby future aspiration. So kindly take it that way. So imagine a scenario where doctor has access to online order, select the test and online order, and lab has a feasibility to online accept the order. And imagine the EMR has been big talked about, so I'm not going to go in detail of it, but through EMR, you have a patient detail also there. And we also talked about payment portal. So payment is done, patient information is online available, and doctor has placed the order. Then when patient comes, things are very efficient, accurate, and very customer friendly, where I have to just collect the sample of patient and give him, commit him date of the report, and maybe some queries I have to resolve. This makes on pre-analytical area big change. The duplication gets avoided because EMR will ensure that same test does not get wrongly repeated. We have seen cases where patient wrongly repeated entire test because he did not show some paper to doctor or doctor forgot to see it and so on. All this gets avoided. So this I see pre-analytical efficiency, cost saving, and improving quality altogether. Then coming to taking the services. This service is not about patient walking into collection center all the time. In fact, on Corona days, we are seeing huge surge in home visit, where patient want only home visit. Now, there is such a load of home visit that to commit timing to each patient is becoming difficult. Imagine an online platform with ease, or on an app, patient can book his slot. In fact, patient can book his slot, say the orders, probably give the TRF test requisition form, and maybe put some request. I want this phlebotomist only come because he gives collects my blood very well. Or in fact, I got some requests like that. Will be new to hear for all of you. I want seropositive phlebotomist only to come because my father is very old. I do not want him to get exposed to corona. Maybe if seropositive person comes, then chance of getting infection is low. All such special requests can be made online. So this is the way I would look at registration. And then I need not talk about it because EMR Nikunj covered it very well, where you're talking about tracking at all levels, right from request to sample given, and then till report tracking, all that if it is available, the patient does not become impatient, his anxiety level goes down, and he knows real time what is happening. This is very low line adoption, which has happened in the industry as of now. Then I think if there is a good IT tool in place, good digitalization happen, your work distribution, emergency handling can happen all well. Now let me take you to analytical area, which is most important to talk about. I think there are a lot of positive changes happening on analytical area and many more to happen. Since you're on COVID day, let me talk about most important one. COVID testing can happen through artificial intelligence, where a person has to just speak from his voice. There is a voice recognition happening, and through artificial intelligence, one can know whether patient is corona positive or not. If you have been part of that clinical trial, and that clinical trial I think is showing very positive result. So this is one area. Now, a similar way, if I have to talk about corona only, we know that cost is a concern, price is a concern. This is not the time where we have to start earning too much of profitability out of it. And hence government is very vigilant that I want to do this test as low and low cost. So some of the government like Assam, they have adopted pooling technology. Now what is pooling? Pooling in simple language, you take 5 patient sample, put it in one tube, small portion of the sample, put it in one tube and run one test. If it is negative, report all negative. But if it is positive, repeat all the 5 samples separately and give the answer. Now, this is a simple pooling. But as you know, when it comes positive, you have to repeat the test 5 times and it adds to one more step. But with digitalization, with IT technology, one new level of pooling which has come, for which we are right now doing clinical trial and results are very exciting. With this new level of technology, you can do pooling up to 31 samples. Means if I have a 961 sample and in that area positivity is less than 2%, I have to do only 93 tests. And in one shot, I can give result of 961 patients. And this is more accurate than doing individual because each sample in the technology you are doing 3 times. So it does not allow you to make mistake also. Suppose you have done mistake somewhere in pipetting, it will catch you. Here you have made a mistake. So this is efficiency, low cost, and improving quality all put together. This is becoming possible. Very soon, this will be laid. Now imagine the cost goes down 30 times lower. Efficiency goes multifold high, and so on. So now we talked about digital pathology part, where, as you know, if I talk only of histopathology or if I talk about only hematology, the experts are very few in the country. If I have to get a very good hematopathologist and a lot of good pathologists, it's not easy. Imagine a pathologist sitting in Guwahati who is expert at a renal pathology. I want his report. How does a Bombay guy get that report? It's very difficult. So if I have a lab setup here where a paramedical staff will process the sample, slides are made, and that image of the slide is seen either real time or as a static image by Guwahati pathologist and reported. And he reports for me entire country. And my liver slides are seen by somebody sitting in Chennai because he's expert at liver, and so on. This improves quality and this improves the scale. I think I make this a good report available across India. Uh, I want to give you a few more examples. Where can I take 2-3 minutes, 4-5 minutes more on this, Vibhor?
Yeah.
If I have to talk about, there are many tests where there is visual interpretation, and visual interpretation, you, me, and third person can differ. But today, digitalization gives you option where you can take this picture and the software reads and digitalization reads whether it is positive, negative, gray, borderline, whatever. It gives you degree. I think Feluda test on COVID, which we are talking about, is on that scale. So that also helps me a lot in doing this. Few more thing on quality. Today, generally, traditionally, labs have been measuring their quality by running some quality controls. They run some samples with known concentration. If the sample result comes within that range, then quality is good and you can run patient sample. But I think quality is much more than that. Many a times, machine starts giving some problem after your controls are run. So control is run, maybe one or two or three samples are all right, but after that, there is a block on the probe and the sample started giving some drift in the result. Now, digitalization gives you an option where it gives you moving averages. So, literally in the lab, there are screens, and the lab supervisor keeps seeing the screen. If my moving average is flat, then my results are going all right. As soon as my moving average graph moves up or down, I have to stop the result. I have to stop the result and I have to stop processing and I have to fix the things. Like that, there are too many things possible on the lab. And the last one I would say, doctors and patients look forward to pre and post test counseling, where doctor wants to know what test I should do. And after the test reports are given for complex tests, they want to know how do I interpret the result. Now, this pre and post test counseling is becoming feasible because of digitalization, and that adds value. And good reports, which is given by you, can really become useful for the patient management. I have not covered all the points, but I thought these were the very important points which I'm sharing with you.
No, thank you. You know, actually, let me just come to my friend Neeraj very quickly. You know, I think there's huge amount of experience, and I can see it, and I think audience must be loving it. And guys, please, an audience, be alert. Listen, this is some fabulous, conversation going. You must be enriched by the end of the day, and bear with me and keep staying with me, right? So, Neeraj, very quickly coming to you. Often, when patient data is gathered, and data, I think, is the critical thing. I mean, that's the new oil, the new gold. I mean, everybody talks it. Let me just put this new gold to you. Often when patient data is gathered at healthcare facility, it is unstructured format. What kind of challenges does this pose for doctors when they want to recall patient information quickly and remotely? How can they navigate this issue? Ladies and gentlemen, I think time is going, but it's just heating up, so be there. Few of our folks in the panel too have their own timings, but press for time, but stay with me for a while. Neeraj, can I take your quick inputs? And then I've got lots of people on my WhatsApp and questions there, so I just want my audience questions to come. Gentlemen, be on with me. Yeah. Come on, Neeraj. Yeah.
I just want to mention one thing. We want to drive e-prescription from our doctors, which was not happening since a year. Because thanks to this COVID time, e-prescription happened at a very fast rate. So we're seeing all the obstetrician and pediatrician was using more than 70 to 75%. And during Corona, we started with only 5% VCs, that is video consultation, and now we are doing around 30 to 40% of VCs platform. So we are doing that. Like, what are the problem which doctor face? I'll just give you one example, and then maybe I'll give example. Sometimes VC is happening, but now the parent want to show one child, second child, and third child with the cost of one consultation. These are the challenges which doctor face and all. So we started a vaccination drive. We started the OPD on a various platform. The vaccination was not happening during Corona time. We started the community vaccination. So our doctors used to go to their clubhouses and we are doing a vaccination there. So thanks to this COVID, our most of the platforms, Birthright platform as a pediatric platform, we are using. I'll give you example. They give a prescription, e-prescription, and they're supposed to collect the prescription from the pharmacy. So we are not losing a pharmacy also, because we have seen whenever we give a handwritten prescription to a patient, patients sometimes leave pharmacy and go. So from the sales point of view, this prescription, you have to take the printout of the prescription from the pharmacy point of view. So they are going to the pharmacy, collect the prescription and collect the medicine from there. So these are the few challenges which we faced and we have solved because of the platforms.
Thank you so much, Neeraj, and I think you really put it on very smartly. And Vinita, can I just take one question from the audience, please? Can you hear me, Vinita?
So this is a very interesting question that has been asked by one of the audience members. The question is, will investments in digitization initiatives lead to an increase in cost for patients? And, Dr. Mohanty has asked this question. So can anyone from the panel please answer this?
Can I talk to Dr. Mohanty? Dr. Mohanty, you got a very valid question. We started one more unit in Bangalore, and our marketing budget was half of it. And we have a wonderful start of our North Bangalore unit of retail. So because of digitization, most of the things which we have not done, but so many digital platforms, like we have done around 5-6 community webinar, and each webinar we are having around 1,000 people. We have done around more than 10 doctor seminar in which around 700 to 800 doctors can come on platform. So because of digitization, marketing budget, hardcore marketing budget is going down. But because of this platform, we are reaching n number of people across at the same time.
Okay, Vinita, do we have another question, or can I ask Dr. Joy to can actually make a comment here? Though I had another quick one to ask Dada from you. Any other question that you all have?
Well, we do have a
Vinita, do
question,
you want to
but
do a?
but so this is a question which I think Dr. Joy Chakraborty can best answer. One of the questions that Deepika Bola has asked is, with the boost in digitization and technology in healthcare, value-based care will increase. How will the people who are below poverty line, which is a huge swath of the Indian population, benefit from this?
I must say it is a very good question, and
Yeah, I just
you
wanted
know
to
that
say
is
that.
a and you know this when you say value-based care, what do you mean? You get a quality care, affordable care, what meets your pocket or your budget. Now, when you say below poverty line, the question is not that a person who is below poverty line, how this is going to be more dearer to them, but it is going to be how it is going to be more effective. So when I say effective, I mean some of the panelists have mentioned about National Digital Health Mission. Now, it is not only for the people below poverty line, but even those who are maybe just above the poverty line. And they are looking for care and they are going to the primary care center, maybe in their rural setup, and they need to move to secondary care center. Earlier scenario, there used to be a lot of time for waiting and the records and reports were not available across the channel. So what will happen in this scenario, digitization and National Digital Health Mission, they are going to ensure availability and accessibility of these reports, records, information for a quick decision making. And in many cases, the tests are not going to be repeated. In many cases, it is going to help them to get a suitable intervention at the earliest. So definitely, this digitization, is going to help indirectly to the people who are economically in the challenged class and who are looking for a effective treatment which is going to meet their budget.
Wonderful, wonderful, and I really see audience, and audience, just bear with me. I have to get my Nikunj very quickly in this one, and then I have a quick fire question with most of you here. Nikunj, I just wondered if you could just give us inputs on this. How can such a system avoid duplication, whether it is managing their visitation schedules, making job? Can you hear me? Yeah.
First, actually, I would like to really thank to bring me in after Dr. Joy's response, which is in line to one of the in the section of this question, National Health Mission, okay, which is actually is all about avoiding the duplicacy, okay, and effective availability and accessibility of the reports and prescriptions for a patient moving to primary to secondary. The whole intent, as I said, is that if we are all working towards like a mission, what government is doing, there has to have actually a common kind of a capacity for within a customer to revisit the same hospital also equally. Like at times, what normally I see in the practice is that, let's say I have got a report done in diagnostics, I'll get it via email. Then I'll forward it to immediate hospital where actually I have to get reviewed and get medication done. Now, probably if I'm actually following up the next, maybe after a month again for another review, another challenge with me, if I have to refer back that, I have to really, in though we are digital, when we say digital, okay, the information is not still available on tips. I have to go back, search on my emails, get the information ready, If I go back for a duplicate copy to the same diagnosis center, he may not have immediately ready, and I'm actually at the mercy of figuring out the information search, and then I will take a decision to rather go for another report, okay, and give it back to the current medical examiner. So when you see this experience of the patient, okay, ultimately they fall into the trap of duplicate reports or duplicate information availability, whether from the new reports or from figuring out from the old records from the current hospital. That is basically the challenge. If we are able to make sure that we have got a patient access section, okay, which is actually getting the information all put together as I showed in my presentation, we, not only the patient but all the patient care stakeholders, okay, would be able to avoid the duplicacy happening into this whole process. And that will get, okay, the single reference, a single repository, okay, which is serving the digital content to all the participating systems who serve to the participating stakeholders by pointing to the same repository. That's the ecosystem which we have to develop to avoid the duplication, bring the efficacy, reduce the cost, and ultimately get the patient treated in time much earlier.
Wow, thank you. I think you really nailed it. I mean, Nikunj, in so very powerful words. And ladies and gentlemen, just stay with for the last round that I have. And may I request all my panel to show up? I mean, really missing you on the screen. So, Prashant, yes, thank you, Dr. Nilesh. And, time has simply flown. I mean, I still have many, and I'm sure people in the audience are there for 12. I can still see, and lots of people to make it, but make sure that, people, your question reach out to this lovely panel and we close the loop. We'll do that. But before I, sum up, I just wanted, gentlemen, that, to your sense, keeping in tandem with the topic, kind of a 30-second or 45 seconds, your take and your message to the industry on terms of digitization, and what do you see for India, the Indian healthcare industry, which is promising, and brands like HP who are really at the forefront of technology, truly partnering and giving that extra edge, the cutting edge to partners like you. So 35 to 40 seconds, please, gentlemen. Limit yourself there. Uh, want to know a key message from your group, you as an industry professional, to this lovely healthcare industry, which we are so very proud of you. Starting with Joy. So let's have some joy here, Dada. Yeah.
Yeah.
I hope I'm clear with the question. I mean, just 30
Yeah, yeah.
second, 40 second.
You're
Yes.
clear. Yeah. So let me tell you that I am here in healthcare industry for last 22 years. So don't judge me my age by because of this experience. But let me tell you,
Sir,
I
क्यों
have
बता
seen a
रहे हो
huge, so it is a huge transition. And for last few years, some of the success stories we have heard from Dr. Nilesha and from the other panelists, the way industry has changed, it is going to be more and more digitized. And it is not for just for the fancy sake, but just to bring the efficiency in the healthcare delivery system, because we need to reach out to many more people. To keep it more brief, I must tell there is a bright future waiting ahead of us, but we need to adapt and we need to embrace this digital technology kind of platform, and then only we can meet probably our alma mater, healthcare for all, which we didn't achieve in 2020, probably by 2030.
Wow, I can't. I mean, you really, I think you really mastered, you said it, and I will just come back to that. Dr. Nilesha, very quickly, your 30 seconds starts now.
If I do not go through digital journey, which is inevitable, we can't survive without it, and I have no option. And if I have to continue keeping pace with the world, I think digitalization journey is critical for us. It is not only bringing efficiency and quality. I think some questions around cost I will touch upon. It is one-time investment, but I feel I'm able to reduce the cost also. So I think I would look forward to going more deeper and deeper into digitalization.
I missed you. You will look forward going for?
I look forward to going into more and more digitalization and up to
Okay.
digital marketing, which was less in lab industry. Somebody questioned also on digital marketing part. See, we had difficulty in reaching to patient level in traditional way. But with digital journey, I think digital marketing is possible, feasible, and it is very effective.
All right, excellent. Dr. Mudit?
Thanks, Prabhu. I think one cannot avoid the digitalization in terms of whether it is healthcare or any of the services right now, which is prevailing across the country. And I think healthcare can never be seen as an individual entity. It is something which is a part of the social ecosystem. And as long as the human development is there, healthcare would be there. I would suggest, I look forward to this, and I think this will be a key factor in coming times. The challenge which I only see is in terms of the infrastructure, which needs to be strengthened further. As someone had pointed out, will it only be restricted to a tier one or a tier two town? I think looking at the population spread and the geographic spread of the country, we need to definitely strengthen the net internet, then facilities for tracking your services. And for that, I think that will be something which will be a key stakeholder where the public sector walks in. Public sector, I mean, the government comes in, state comes in, whereas the private health sector would continuously be piggybacking on that and providing the service. It will improve the services and the customer will be empowered. So he'll push us, all of us providers, to do better.
Awesome. And thank you, Dr. Mudit. Neeraj, can I take yours?
Yeah. See, digitization of healthcare is here to stay. The people who embrace this technology, they'll go ahead. So I wish we should have a paperless hospital, because whenever patients and his relatives come to hospital, they come with a large reports and papers and so on. So I wish to see a paperless hospital using more and more digitization of record and processes. And I wish to see this hospital is coming up now.
All right, wonderful. Prashant?
In order to take the leverage of the digitization, basically, I urge to increase the adopt of the EMR standards, so that a lot of comparisons can be made across healthcare chains or the middle layer or the higher layer healthcare organization, so that some kind of decision making can be made easily. So that'll take the quality to the next level, basically.
So you're saying quality by adopting EMR standards, right?
Standards, yeah.
Yeah. All right. Awesome. Nikunj, your this one.
So my takeaway would be that connected healthcare solutions with enterprise imaging, EMR optimization, administrative automation, and the continuum of care all put together to improve the patient experience.
Sorry. I was just trying to pen it down, and absolutely, I would really want to. Did I miss anybody? I mean, I had a great panel. Please, is there anybody? I hope I haven't missed. I know a couple of people. Rajiv had to leave, but nonetheless, ladies and gentlemen, a big hand, a big thank you for you, all of you there who have been with us for long and enjoyed the conversation as much as I'm enjoying myself. Ladies and gentlemen, it's been a marathon evening, but truly of substance and a lot of great content, great knowledge, excellent speakers. And the parting shots from Joy said, digitize, efficiency, bright future, adaptability, imperative, enhanced digital healthcare. Mr. Shah say it is inevitable. It is critical. Digital marketing is feasible. So those are the golden words from him. Dr. Mudit said it's unavoidable. You can't see healthcare in isolation, Dr. Mudit. I 100% agree with you. And tier 2, tier 3 people who are here, make sure, there we got such an excellent wisdom here with me, people. They will reach to you the complete pan India. I think the healthcare is reaching, and I think people with me are making it possible, right? And Neeraj said, it should be a paperless, sustainable hospital. How much I agree. I was reading somewhere said that there's also a delay. And I think there is something somebody said on voice automation, and one needs it. So that enhances the speed, adaptability. Absolutely brilliant. Prashant said something, EMR standards and quality. I think that's very, very important to have, especially in healthcare. You have to be an absolute 100% precision. It is not by fluke. You have to make sure each time, every time. Nikunj, thank you for bringing that technology, and helping us, making it simple and making our partners and your co-panelists understand what a breathtaking technology advancements that you're doing, keeping it hard at the core, the patient, his experience, his journey, and making connected healthcare, automation, and fabulous speaking to you, all you folks. And, at Healthcare Radius and ITP, my colleague Vinita, Rohan, Mitali, and whole team behind Amrita, who have put together and Big hand for Riti and Sumit out there as well. Just want to say this is how it has spanned out. This was quite an engaging conversation about how digitization can help healthcare service providers improve patient experience, reduce operational cost, avoid medical errors, and enhance efficiency in the delivery of curative services. With India poised to become a hub of medical tourism, it goes without saying that the quicker they adopt digitization, the better they can position themselves as a global player. Ladies and gentlemen, I 100% agree, and I thoroughly enjoyed this conversation. And I want to say a big thanks to all of you. And people, I still some few questions. I'm feeling sorry about it, but I can't hold these people. They are really taking care, not only us, but the rest of the country. Thank you very much. Thank you once again.
Thank you.
Thank you, Bibor and team.